Okay, thanks, Ash. Well, we hear a lot about back pain, but did you know that many cases of discomfort stem from a condition in the pelvis? Here to explain is Dr. Knopp, a pain specialist at the Hartford HealthCare Pain Treatment Center. Thanks so much for being here with us today.
Thanks for having me.
So, Dr. Knopp, starting off, does this condition have a name?
So it's actually an all-encompassing condition called pelvic obliquity, which essentially can predispose to back pain, hip pain, SI joint pain. And the idea is that the pelvis is misaligned for whatever reason, either secondary to tight muscles or weak muscles. And as a result, there could be a tilt forward or backward, which can predispose to either back pain or SI joint or hip pain, like we spoke about.
How exactly is this caused?
So again, secondary to tight muscles, either in the front of the body or in the back of the body, over time, it can cause a shift in the way that we walk and the way that we kind of compensate for our gait. And as a result, you can get a shorter leg, or the pelvis can either tilt forward or backwards. And there tends to be compression in areas where there shouldn't be compression. So you may feel pain throughout the buttock region, the hip region, or the low back.
Obviously, as you explain it, a lot of pain. So what treatment does the Hartford Hospital Pain Treatment Center offer for those who have this condition?
So besides all the typical treatments like injection therapy or physical therapy, we're actually more cutting edge. We're looking at newer technologies, and one of the newer technologies out right now is called Sprint, which is essentially a peripheral nerve stimulation system, which it's medication free, and the way that it works is that we use very thin wires to kind of change the way that these nerves transmit pain from that painful area back up to your brain. And it's something that's becoming more commonplace, but a lot of doctors and facilities are not doing it, and we're doing it quite a bit over here.
What are the expected results from something like that? And I guess how long do people have to go through these treatments to start seeing those results?
So starting with the evaluation and then with some more of our conservative treatments, anywhere from the range of 3 to 6 months. The idea is that after that course of treatment, we'd like to obviously decrease the pain, but also improve your function, and kind of shifting that talk towards being able to do things that patients weren't able to do before.
Okay. Thank you so much for all that information. Right there on your screen, you see where you can go online to get more information. Dr. Knopp, thank you so much for joining us today.
Thank you.